Hello, my name is Melissa Stockey, and I'm a certified aesthetic nurse specialist, nurse injector at Cynthia Gregg MD Face and Body Specialist. Welcome to our Fall Patient Appreciation Day. This video is titled Hyperdilute Radiesse, Tightening the Skin Above the Knees and Arms. I'll be showing you a live demonstration of hyperdilute radiesse on an actual patient. A prime candidate for this procedure is someone who has crepey skin on the inner upper arms or above the knee area that will not resolve with diet, exercise, and simple hydration. As we age, our skin will lose collagen that once helped the skin stay tight and wrinkle-free. Collagen and elastin fibers break down, causing the skin to loosen, thin, and wrinkle. In order to understand the procedure and how it works, it's important to understand what is actually happening to the skin when injected. Radiesse is a biostimulator and a filler typically used for volume supplement. In this procedure, we are not adding volume, but rather diluting the product in order to fan it into the space that we would like to incorporate these biostimulating properties. Biostimulation simply means just to produce one's own collagen. So Radiesse is made of calcium hydroxyapatite, which is scientifically known to collagen stimulate. So using this product in a diluted form allows me to inject it more superficially and in a larger area, providing dermal rejuvenation and tightening of the body. The protocol for this procedure starts with using elastin transform for the body, and elastin uses this trihex technology that's designed specifically for skin tightening procedures to accelerate results. Radiesse is then used diluted with saline and lidocaine to ease any procedure-related discomfort. The Radiesse, saline, and lidocaine are now mixed thoroughly in order to inject it into the skin with a microcannula. This piece of the procedure is important to ensure that the solution is fully mixed, so once injected, the collagen stimulation can begin. The solution now contains the calcium hydroxyapatite microspheres that are now suspended in this solution. Once injected, the spheres will continue to work by stimulating the body to produce its own natural collagen. Over time, the solution is absorbed by the body, metabolizing the microspheres and leaving behind your own natural collagen. Next, it's time to prepare our patient for injection. I've already educated her on making sure to refrain from wearing any lotions or sunscreen on her way to the visit. I'm going to go ahead and cleanse the area with both alcohol and hypochlorous acid. We've already taken a set of baseline photos and discussed the pre- and post-injection protocol. As discussed, Andrea will be applying 2 pumps of elastin transform to the injection site twice daily. She's also going to limit her cardio and sun exposure for 72 hours after injection to give her body some time to heal. Although bruising and swelling can occur, it's often minimal. So here you can see my patient received the treatment in 2 sessions, and she was able to see results as early as 6 weeks and continues to see results 6 months post-injection. Despite diet and exercise, due to the nature of how our skin ages in those specific areas, this patient was unable to smooth or tighten the skin with just simple hydration. She used the Transform twice daily before and after her procedure, and because of the nature of the procedure, producing her own collagen, she still appreciates results over time. And as you can see, the procedure I performed on her not only reduces the wrinkles and fine lines, but also added a nice tightening effect that lifted her knee area. Results are extremely technique dependent, and I'll discuss the procedure in more detail next. A really important part of this procedure is using a tool called a blunt tip microcannula. This tool injects and fans the products into the superficial crepey areas, allowing not only biostimulatory effects of the radiesse, but also providing additional collagen production with this tool. The microcannula is not sharp and is able to allow meticulous placement of the product under the skin, but also allowing the body to heal from fanning technique, producing maximum tightening and lifting in the key areas. Although the procedure may look painful due to the addition of lidocaine into the syringe of product, it is virtually painless for the patient. Not only am I going to inject the product into the crepey areas of the patient's skin, but I'm also injecting the product and using the cannula in the areas above the crepiness to provide a lift in appearance to the knees. Stay tuned until the end of the video to see the before and after photos of the patient I was showing earlier, where you can not only see less crepey skin, but actually lifting of the knee area. Here's Andrea right after her procedure, and as you can see, she has minimal redness or bruising. We were able to talk during the procedure as the lidocaine allows for patients to receive this treatment with minimal discomfort. The end result of the procedure will start to show results 6 weeks after her injection, and she'll continue to yield results for several months after, having indefinite results of her own collagen stimulation. Here's the image of the final before and after of the patient's leg and knees I displayed earlier. Again, notice that the knee lacks crepiness, but due to the technique used, you'll also see that it has a lifting and tightening effect above her knee. Thank you for watching my presentation, and if you have any questions, please email me at injectablequestions@cynthiagregmd.com, and I'll respond within 2 hours. I look forward to answering your questions about hyperdilute radius to the knees and arms.